Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. William James had said, "Is life worth living?" And it all depends on liver. The liver is the powerhouse of our body, credited with performing more than 500 functions in the body. It is said to be the second most important organ in our bodies. Today in Wellness Watch, we explore the importance of liver in the human body, what happens when it malfunctions, is liver transplant a viable option, and how does one live with it? I'm your host, Preeti. The liver, one of the most vital organs in our body, works tirelessly to filter toxins, process nutrients and keep us healthy. But liver disease is on the rise, affecting millions worldwide, often without early warning signs. From fatty liver to cirrhosis and liver cancer, the damage can be life-threatening. For some, a liver transplant becomes the only hope for survival, but with organ shortages, high costs and medical risks, the road to recovery is never easy. So what are the causes, symptoms and solutions, and what does life look like after a transplant? Here's a report by DD India's Harshita Oberoi. The liver is one of the hardest working organs in our body, performing vital functions like aiding digestion, producing bile, detoxifying harmful substances, and maintaining blood sugar balance. It is our body's engine, fuel processor, and immune defense system all in one. But when this powerhouse weakens, the damage can be life threatening. The dangers are real: fatty liver disease, hepatitis, cirrhosis, and even liver cancer. These conditions don't appear overnight. It starts subtly, fat slowly builds up in the liver. Over the time, healthy cells turn into scar tissue, leading to a liver failure. If left untreated, the consequences can be deadly. What causes this silent destruction? Excessive alcohol, drug abuse, diabetes, obesity, and hypertension are the major culprits. But even those who don't drink are at risk. Non alcoholic fatty liver disease is now a growing epidemic driven by unhealthy diets and sedentary lifestyles. If ignored, it can escalate to irreversible liver damage. There are warning signs: upper abdominal pain, bloating, jaundice, dark urine, swelling, fatigue, and loss of appetite. These symptoms should never be ignored. The liver has a remarkable ability to heal, but only if we act in time. Maintaining a healthy lifestyle can make all the difference. For those with end stage liver disease, transplantation becomes the only option. There are two types of transplantations: living donor transplants, where a healthy relative donates a portion of their liver, and diseased donor transplants, where the entire liver is transplanted from a brain dead donor. Patients with cirrhosis, liver cancer, and acute liver failure often require transplants, but not everyone qualifies. Eligibility is determined through medical tests and urgency scores like MELD and child pug. Liver transplantation in India faces multiple challenges. A severe organ shortage means most transplants rely on living donors. The high cost, 20 to 30 lakh rupees, makes it unaffordable for many. Medical risks like rejection and infections add to the struggle. Limited rural access, legal hurdles, and cultural hesitation worsen the crisis. Even after surgery, lifelong medication and follow ups are essential. With proper care, transplant recipients can lead full and healthy lives. However, they must follow strict guidelines. Routine medical checkups, balanced nutrition, regular exercise, and immunosuppressant therapy are followed. A liver transplant can last a lifetime with proper care, offering patients a second chance at life. Success rates stand at 90 to 95%, depending on the patient's health before surgery. But strict laws govern organ donation. Organ trading is illegal, and only close relatives can donate, with thorough legal and medical scrutiny ensuring ethical practices.
Liver disease is preventable, but once it reaches a critical stage, a transplant is the only hope. Awareness, early detection, and a healthy lifestyle can save lives. Take care of your liver. It's a key to your well-being. Harshita Oberoi, reporting for Wellness Watch, DD India.
Liver, as we told you, is the largest internal organ and plays a vital role in regulating blood sugar, filtering toxins from the blood, producing proteins essential for clotting, metabolizing nutrients and storing vitamins, all within a single organ. That is why liver is also called the most complex organ of the body. But what happens when this powerhouse of the human body malfunctions? Liver failure means that your liver is shutting down and failing to perform its essential functions. Now, this can happen rapidly or gradually. Symptoms of liver failure can affect almost every major body system. When liver failure is final, it can be fatal without a liver transplant. Today in Wellness Watch, we look for answers to the following questions. What is liver failure? What are the stages of liver failure? When is a liver transplant needed? What are the types of liver transplants? And what medical advancements have been made in India? Every week in Wellness Watch, we acquaint you with the medical options available in India that showcase India as a medical hub to the rest of the world. And up on your screens, we will have hospitals and institutions that particularly cater to the liver transplant needs. Up on your screens, we'll have the graphics. All India Institute of Medical Sciences, Delhi. Institute of Liver and Biliary Science, Delhi. Government Medical College, Thiruvananthapuram. Dr. Ram Manohar Lohia Hospital, Delhi. Now, these are some of the prominent hospitals in the country that provide services, world-class and reliable services with regard to liver transplant. Dr. Piyush Ranjan, Senior Consultant and Vice Chairman, Department of Gastroenterology, Sir Gangaram Hospital, New Delhi is joining us virtually. And also Dr. Babulal Meena, Assistant Professor, Department of Hepatology, Institute of Liver and Biliary Sciences, Delhi is joining us virtually. I welcome both of you on Wellness Watch this afternoon. Dr. Ranjan, I would want you to explain to our viewers first, what is liver transplant? We've given a detailed report to our viewers telling them about the dangers if the liver malfunctions. But I would want you to explain to our viewers in simple terms to start the discussion, what is liver failure?
So, thank you for these questions. These are very pertinent questions. Liver is an organ which is underappreciated, and you realize its importance only when it stops functioning. So liver failure can be divided into two categories: acute liver failure, when a person is otherwise healthy and suddenly develops jaundice followed by loss of consciousness, altered sensorium. This happens usually in acute viral hepatitis, most commonly in our setting, and other things like paracetamol poisoning is the most common thing in the Western world. So here, this is known as acute liver failure, where liver was completely well beforehand and then develops sudden massive necrosis of the liver structure, and consequently the liver stops functioning. Here, liver transplant is considered an urgent and life-saving thing, and there are criteria for that. In other category of diseases, which is known as liver cirrhosis, as you have mentioned in your video, where the liver function gets affected gradually. The most common causes being alcohol, fatty liver disease, hepatitis B, C, autoimmune liver diseases. Here, over a period of time, because of ongoing inflammation, the liver starts becoming weak and the function becomes poorer. Here, the signs of liver disease are jaundice, hematemesis, that is blood in the vomiting, ascites, encephalopathy, that is loss of consciousness, and a person may develop tumor in a background of a liver which is chronically inflamed. So these are the conditions where you would require, once the liver has stopped functioning beyond a limit, and there are simple scores, the most common score being the MELD score, MELD, Mayo and stage liver disease score, which is calculated on simple parameters, and then you decide that a liver can be replaced.
Okay.
So these are the conditions where liver transplant would be required, and liver transplant, as shown, can be done by the. For transplant, you require the existing liver to be taken out of the body, and the liver needs a new, and the body needs a new liver. So the source of this liver can be either from a live donor, when it is known as a live related liver transplant, or a cadaveric donor, where from a brain dead body, when the relatives voluntarily decide to donate the organ, then you can retrieve it and then transplant into the body when it
All
is the
right.
deceased donor liver transplant. So LDLT and DDLT, these are the two common types of liver transplant.
Transplants. Okay. I'll take that forward to Dr. Meena. Dr. Meena, help us understand, what are the first signs or the first symptoms of a bad liver? Because Sir tells us that it happens gradually. But then how does one would know that liver of his, his liver is in danger? What are the early signs or symptoms one should look for?
So this all depends on causes of the liver failure. In case of acute liver failure or acute hepatitis, the constitutional symptoms like fever, pain, abdomen, nausea, vomiting is the most common presenting symptom, followed by occurrence of jaundice. And then obviously, if the liver fails after to a certain limit, more than 70 to 80% necrosis, there is appearance of ascites and hepatic encephalopathy. So these are symptoms in the setting of acute liver failure and acute hepatitis. That is commonly noted in patients who suffer acute hepatitis or liver failure because of viral infections like hepatitis A or E, and maybe because of toxin induced liver injury like paracetamol, or some common poisons, household poisons like rat poisoning. But in cases of chronic liver failure, the common presentation initial part may be unnoticed, or patient may feel pain in the right upper quadrant, that is at the right part of the abdomen, and maybe some non-specific symptoms like bloating, fatigue, and nausea. So these are the initial presenting symptoms of liver disease. But obviously, when liver injury occurs to a certain extent, then some patients present with jaundice, like patient with hepatitis B, and patient with alcoholic liver disease, they also present with history of jaundice. But at the later stage, some patient may not mount jaundice and directly present with ascites, that is fluid accumulation in the abdominal cavity, and other symptoms like GI hemorrhage, bleeding from the GI tract, and encephalopathy because of altered liver function. So these are the common presenting symptoms. At the later stage, some patient may develop liver cancer also.
Okay, so that was about the stages of liver failure. But Dr. Ranjan, when is it that a person needs a liver transplant? If a liver is malfunctioning, to what extent can medications solve this? And when is it that a person needs a liver transplant?
Look, whenever we talk of managing liver disease, there are two aspects of managing liver disease, cirrhosis. One is you treat the etiological factors, that is the factor which is damaging the liver. And the other thing is that when you treat the complications of the liver disease, the complications of liver disease, as we have mentioned, that ascites, encephalopathy, bleeding. So, as you would understand that if a person has got hepatitis B, you try and treat hepatitis B, the liver might recover. If a person has got alcohol intake, you try to persuade him to stop alcohol. If the person is obese, you try to reduce weight, and this might lead to improvement in liver. If the person, this is the etiological treatment, treatment of the cause. The treatment of complications include control of ascites, management of bleeding, and management of encephalopathy and things like that. And there are medical and other interventional treatments which help in this. So once, despite doing both these things, the liver starts losing function, then there are two scores. The child spew score, which is classifies patients into child A, B, and C. If the a person has got a child spew score more than 7 and 8, then in a setting of cadaveric liver transplant, there are two things that when you have a cadaveric liver transplant, you have listing criteria that beyond a function, deterioration of function, you list the person for transplant.
Okay.
And then, as and when an organ is available, you give an organ to them. And in those criteria where MELD is used as the most common listing criteria, you have certain exceptions like a patient who has got hepatocellular carcinoma can't wait for long. These patients are given additional scores. But in our system, where we have mostly live related transplant, when liver transplant is not so effective, you have a live related transplant. Then that once you have a fit donor and you have an appropriate time according to MELD score, and there are certain indications which do not follow the MELD score, like development of pulmonary hypertension, intractable pruritus. This list is long, so and a little technical, so I will not go into that. So then you decide to have a fit donor, and then you can proceed with a transplant.
All right. Dr. Meena, when we talk of liver transplant, what is the road to recovery? What happens post surgery, and what are the complications that one can face?
Yeah, so after transplantation, the majority of the complication occur in first 1 to 2 weeks of transplantation. That is predominantly in the form of infections, and the majority of the patient recover after 2 to 3 weeks of liver transplant, and few of the patient may get discharged after 2 to 3 weeks of liver transplantation with continued medical care in form of immune suppression. So after transplant, the steroids and certain medications like steroid sparing agents, tacrolimus or mycophenolate mofetil. So these are the important agents, molecules we give for immune suppression to protect the rejection of transplanted liver. And patients should be continued under the medical care to prevent further complications. So initial complication occur in the form of infections that is easily managed after transplantation with continued medical care with use of antibiotics. But later on, these patients require continued medical care, and so few of the patients, around 20 to 30 patients, 20 to 30% of the patients may face some sort of liver rejection. So these patients may require a more attention, more attentive care in the follow-up, and sometimes may require liver biopsy and modification of the immune suppression treatment. So, recovery typically occurs after 1 to 2 months after liver transplantation, and majority of the patient may resume their normal routine work after 1 to 1.5 months after liver transplantation, and may start some exercises or heavy work after 2 to 3 months of liver transplantation. And survival is very good, but this all depends on the stage of liver failure we do liver transplant. Like patient with stable complications, patient with cirrhosis and stable disease without infection, without any cardiopulmonary failure, there is very good survival. More than 90% of the patients survive for 5 years. And liver, liver is a very good organ, so body adapts the foreign liver very well, and later on we decrease the immune suppression. Majority of the patients can be maintained on lower dose of immune suppression, and in certain selective population, maybe after 5 6 years of transplant, when there is minimal risk of occurrence of rejection, we may minimize the immune suppression treatment, or we may stop the immune suppression in certain specific population of selective patients.
All right, for our viewers who've just joined in today in Wellness Watch, we're discussing liver transplant. What happens when a liver of a person, the powerhouse of the body, malfunctions? And to discuss and to help us understand this, we have guests joining us virtually this afternoon. We are joined in by Dr. Piyush Ranjan. He is Senior Consultant and Vice Chairman, Department of Gastroenterology, Sir Gangaram Hospital. We're also joined in by Dr. Babulal Meena. He's Assistant Professor, Department of Hepatology, Institute of Liver and Biliary Sciences, Delhi. Dr. Ranjan, help us understand what are the risks and side effects associated with liver transplant?
So, as Dr. Meena told you, liver transplant, the phase, I would say that the first year of post-liver transplant is a challenging phase. In the initial phase, when you see that you have placed a foreign body in the human system, then the first thing would be the risk of rejection, because the immune system of recipient starts perceiving this organ as a foreign body and mounts a response. Fortunately, liver is a very immune tolerant organ, and the risk of rejection is not as high as there is in the kidney transplant. And in this phase, to prevent rejection, we give drugs which are immunosuppressants. And as Dr. Meena told you, that there is a risk of infection in the initial phase. And then the problem with liver transplant is that there are complex anastomosis. The bile duct, the portal vein, the hepatic veins of the donor and the recipient all have to be reconstructed. This is relatively straightforward in cadaveric transplant, but in live transplant, these anastomosis become complex, especially the biliary anastomosis.
Okay.
So in the initial post-operative phase, there can be problem related to each of these transplants. The most dreaded complication is hepatic artery thrombosis, which occurs quite initially. And if there is hepatic artery thrombosis, then the graft does not remain viable, and retransplant is the only option. But this is uncommon, very uncommon. And then there are biliary complications where the bile ducts are anastomosed. There can be leakage of bile, there can be biliary stricture. In the initial 3 months, there can be bile leak, and then subsequently till 1 year, there can be biliary stricture. But all these complications can be managed with endoscopic interventions or radiological interventions. And immunosuppression related complications, infections, as was mentioned, can be managed very well by uh, mm, change of by effective antibiotics, antifungal agents.
Right.
And the pre-existing condition of the patient, especially related to nutrition, the cardiac weakness, the lung conditions which are a consequence of liver cirrhosis, they also pose a challenge. So nutrition becomes very important, lung and cardiac conditions become
Right.
very important, and other comorbid conditions become very
Okay.
important. But you need to continue immunosuppression. You need to look very carefully for further complications, and the survivals are usually in good acceptable ranges. And we must remember that these survivals, even they are not 100%, if not transplanted, there is usually a very high rate of mortality in these patients who are not transplanted.
All right, there is positive time. Sir, I would want you to acquaint us with what medical advancements have been made in India with regard to treating liver damage or liver failure, and also the options for liver transplant. Dr. Ranjan, you first.
You see, I mean, the services which we have in our country, I would say, are at par with anywhere else in the world. And I mean, the Dr. Meena is working at a place which has been at the forefront of such researches, and we at Gangaram Hospital also have. I mean, Sir Gangaram Hospital was the place where liver transplant first started in India into way back in 2001, 2002, and subsequently it has taken off. Now we have the entire country has so many centers, and we predominantly do life related transplants. There is a challenge in having donors, and there are many conditions, there are many assist devices which now function to uh, tide over the patients in sick conditions, and things like tips, plasma exchange.
Right.
These are the things which have come up which help to tide over these patients during the crisis till the organ is available, and these are required.
All right. Dr. Meena, would you add to it, please?
Yeah, so I agree with Dr. Piyush Ranjan. So these are the advances, and as it was said by Dr. Piyush Ranjan, The first transplant was done in Sir Gangaram Hospital. So the more important point is the patient who received first liver transplant from SGRH. So he also, that side also become a doctor, MBBS doctor around 5 6 years back, and he survived still now. And there are, I would like to add few advances like in India, there is obviously we are performing mainly living donor liver transplantation. Few of the centers are performing deceased donor liver transplantation. The problem with deceased donor liver transplantation is the lack of awareness in the community, and we rarely get to know that a few of the brain dead patients relative, they are trying to donate their liver to
Right.
and offering their liver to patient with cirrhosis or liver disease. So now we are in the way that we should increase the number of deceased donor liver transplantation in India, and this is mainly done in the South India, but there is
Yes.
a few of the organizations are working on that, and probably we will achieve increased number of deceased donor liver
Right. So we
transplant.
have world-class facilities available in India, but then to give to clear more doubts of our viewers, we'll have a quick rapid-fire question round. I would request you to give a one-word answers for the questions which are put to you. Dr. Ranjan, first, the donated liver quality differs for alive and deceased donors. Is it so?
Please ask that again.
Yes, I'll put the question again. The donated liver quality differs for the deceased and alive donors. Is it so?
No, you see, the diseased donor, the volume of the liver is important. In live donor, in diseased donor, you get a larger, you get the whole liver.
Right.
And in live transplant, you get a part of
Part
it.
of the
So
liver.
there is something known as GRWR, where according to the weight of the recipient, you try to
Right.
take permissible limit of liver volume from the donor, because after all, he also has to survive.
Okay. Dr. Meena, liver transplantation cannot be done before a specific age. Is that true?
That is for living donor liver transplantation. Before 18 years of age, the person cannot donate the liver. They should attend the adulthood before
Okay.
consenting about liver donation. But that is not for the recipient. For recipient, liver transplant can be done at any age. In patient like
All right.
metabolic disorders, maybe around at 1 to 1.5 month of age. Patient in the metabolic disorder in USA, they transplant after 1 to 2 weeks after birth because they have metabolic screening program. They screen the baby after birth. If there is metabolic disorder, they transplant immediately. They don't wait for disease to occur. They transplant before the start of the disease.
All right. I'll thank both of you for joining us this afternoon on Wellness Watch and helping us understand the challenges of liver failure or the risks associated with it, and also helping us understand liver transplant. Thank you both of you for joining us. In the intricate orchestra of the human body, the liver stands out as a maestro, orchestrating a symphony of metabolic processes essential for our well-being. It is the body's largest organ and needs the greatest attention. A healthy liver is synonymous with vitality and well-being. Preserving liver health is paramount for overall well-being. Incorporating simple lifestyle changes and adopting liver-friendly habits can go a long way in safeguarding this vital organ. After all, a happy liver contributes to a happy existence. On that note, we end this edition of Wellness Watch this afternoon. Till we meet next, take good care of yourselves.